Have you heard me talking about marijuana and dementia care and you want to know more about how to use it? Hi, I'm Joanna. I'm a dementia expert. I've been caring for people with dementia for 20 years, and I make videos like this every day, so don't forget to follow me. So I spoke previously in a video about what benefits marijuana has on people with dementia, and I want to talk a little bit more about that today. So first thing to know again is that there's two strains of marijuana. One is an indica and one is a sativa, and they work differently for different things. So if you're looking for someone with Lewy body dementia or Parkinson's dementia or stage 6 Alzheimer's disease where they have a lot of hallucinations and delusions, we found at Memory Lane with a lot of our residents that the sativa kind of marijuana can reduce hallucinations and delusions by almost 50% or more. And I've seen it honestly give so much more quality of life for people with dementia, especially the Lewy body time or Parkinson's, because when they take antipsychotic medications, it typically makes them worse. But when they take sativa marijuana, they have a lot of positive benefits. So this is what I recommend for that. Now, for the indica kind of marijuana, I like to use that for people that are having issues with agitation, aggression, sleep issues, or difficulty with eating, and they work really, really well for that. And they work good for Alzheimer's or frontotemporal type dementia. So typically, marijuana gummies come in 10 milligrams. Some of them come in 5s. I like this brand Choice because it's pretty inexpensive and it tends to work quickly. So it's worked really well for us in the past. When you start marijuana, you want to use 5 milligrams at a time. So cut a 10 milligram in half and then increase it by 5 milligrams if it's not working. So we typically would use this 5 milligrams anywhere from 1 to 3 times a day, and we did have people that were all the way up on like 15 milligrams as well if they needed more. So it really depends on the person. But that's a great suggestion. Use these gummies, and if you're having a difficult time getting them to take the gummies, sometimes what we would do is actually mix them with other gummy candy like peach rings or juju beans or things like that that kind of look a little bit like it, and give them like a little cup full of candy, and that being one of them, and then just watch them until they eat it all. Hope that helps, and in my next video I'm going to talk about 2 other kinds of marijuana that you can use for helping people with dementia. And if you're interested in more Dementia 101 tips, check out my website at www.mlfnd.org for my Dementia 101 course.